Have you ever been told you have pulmonary hypertension after an echocardiogram and wondered what that actually means? Or maybe you've noticed increasing shortness of breath, fatigue, dizziness, or difficulty keeping up with activities that used to feel easy. Today we're going to simplify one of the most misunderstood conditions in pulmonary medicine, pulmonary hypertension. By the end of this video, you'll understand what it is, why it happens, and why finding the underlying cause is often more important than the number itself. Let's get started. Pulmonary hypertension simply means elevated blood pressure within the blood vessels of the lungs. Most people think of blood pressure as the number measured in the arm. Pulmonary hypertension is different because the increased pressure occurs specifically in the circulation between the heart and the lungs. Think of the heart as a pump and the lungs as the place where blood picks up oxygen. Blood leaves the right side of the heart, travels through the lungs to collect oxygen, then returns to the left side of the heart where it can be delivered to the rest of the body. When pressure inside the lung circulation becomes elevated, the right side of the heart has to work much harder to move blood through the lungs. Over time, that extra workload can become significant. So why does this make people feel short of breath? Many patients assume the problem is simply not getting enough air into the lungs. Sometimes that's true, but often with pulmonary hypertension, the issue is blood flow. If blood cannot move efficiently through the lungs, oxygen delivery becomes less effective, especially during physical activity when the body needs more oxygen. Think of it like a traffic jam. The oxygen may be there, but the circulation responsible for transporting it becomes congested. The result can be shortness of breath, fatigue, dizziness, reduced exercise tolerance, chest discomfort, and sometimes swelling in the legs. One question I often ask patients is, when did activities start becoming harder than they used to be? Many people don't notice symptoms right away because pulmonary hypertension often develops gradually. Now here's something important. Pulmonary hypertension is not a single disease. It is usually a consequence of another medical condition. In medicine, we divide pulmonary hypertension into 5 major groups. The first group involves diseases that directly affect the blood vessels of the lungs. The second group is commonly caused by heart disease, where elevated pressures from the heart back up into the lungs. The third group includes chronic lung diseases and conditions that lower oxygen levels. This is where many pulmonary and sleep medicine patients fit. Conditions such as chronic obstructive pulmonary disease, pulmonary fibrosis, obesity hypoventilation syndrome, and sleep apnea can all contribute. One interesting example is untreated sleep apnea. When oxygen levels repeatedly drop during sleep, blood vessels in the lungs naturally constrict. Over months and years, this can increase stress on the pulmonary circulation. This is one reason why treating sleep apnea and correcting low oxygen levels can be so important. The fourth group is caused by chronic blood clots within the lungs. The fifth group includes several less common conditions that don't fit neatly into the other categories. A common question I hear is, can pulmonary hypertension improve? The answer depends on the cause. If elevated pressures are being driven by low oxygen levels, sleep apnea, heart disease, obesity hypoventilation syndrome, or certain lung conditions, treating the underlying problem may improve symptoms and reduce stress on the heart and lungs. That's why the most important question is often not how high the pressure is. The most important question is why the pressure is elevated in the first place. If you've been diagnosed with pulmonary hypertension, don't focus only on the number. Focus on understanding the cause, because the underlying cause is often where the greatest opportunity for treatment exists. If you found this video helpful, leave a comment below and let me know. Have you or someone you know been diagnosed with pulmonary hypertension? And what questions do you still have about it? Don't forget to subscribe to the Pulmonary Perspective for practical pulmonary and sleep medicine education, explained in a way that's easy to understand. Thanks for watching, and I'll see you in the next video.